Hello everyone, my name is Anchit Mittal and I am today doing the postcard session with the renowned personality of healthcare industry with Hara Prasad Misha. He is the physician at University of Delhi. A warm welcome, sir. How you are feeling today, sir? I'm feeling great. Sir, sir, what's bring you this InnoHEALTH conference? It's my second time at InnoHEALTH, and practically I have been working in the digital health ecosystem for the last 5 odd years, contributing to the startups and the MNCs, and also had a work ex with Dr. Sarvati, who is working at the Flight to Delhi. So like it has been second conference, so pretty feeling good. Sure. So the theme of the conference is clinical validation of emergence technology. So how you think that this emergence technology is a part of an academic part of a upcoming youth? What's take on this? Yeah. So see, this is a very important theme. For example, like whenever we talk about clinical validation, we need to understand that the healthcare workers, starting from the physicians to the nurses, as well as the paramedics, needs to get the training in AI and also ML to a great extent. But if we try to understand the current academic curriculum, then it is not a part of that. So they need to pivot. So they need to upskill and learn from other sources. And what I will also encourage is that they can do some part-time or some summer or winter internship programs in various research institutes. For example, IIIT Delhi, today the venue is that. So that is also a good place. They can reach out to faculty, and also they can do a lot of courses which are available online, be it certification courses or YouTube sessions. But real life work example is very important, so they can work in various startups. For example, in my personal experience, I had a work ex with Flipkart where I contributed building their health GPT. Okay. And DOSI, which was discussed today, a remote monitoring health startup, that we worked for their cardiac portfolio. So I will encourage the younger crowd, especially the medicos and the paramedics, start learning because it is a very evolvable field and a lot of good opportunities will be coming up both nationally and internationally. So you can make a good impact and financially it's going to be pretty good. Sir, can you please suggest some examples of like what kind of AI technologies we have to develop, like for a freshers as well as for the professional ones, to encourage your skills? Yeah. So see, first of all, most of the people who are either in the life science background or in healthcare, mostly we find they don't have mathematics as their background, right? But yeah, like for if you take my example, I had it, but I will strongly encourage that you develop basic mathematics because stats is something that is pretty needed in this stuff, right? Always you find graphs, charts, a lot of number crunching happening. So that is something I want you all to work upon. And a lot of people approach me saying, Dr. Hara, do you need programming to learn? So the answer is, if you can, it's a big yes. Okay. But if you can, or if you're afraid of, then it's not a must because nowadays there are a lot of softwares coming up which encourage DIY, that is do it yourself. And there is nowadays, today's in the conference, we also talked about low code and no code platform coming up. But what I suggest is that stats is something you need to work upon, and upon that, something on the side of learning the basic terminologies initially for the beginners. Okay. Once you're done with that, then you can proceed to a medium or a higher level advanced courses in which you can define a target area. For example, a lot of graduates are from life sciences, so they will be converting into bioinformatics. So they can work in that setup. A lot of doctors who are there, they can work based upon the speciality. For example, today we had a discussion on radiology part, right? They will work more on the computer vision. Whereas a lot of people who are in the, for example, I have a pharmaceutical background, so I work in the drug discovery part and applying it on the clinical trial. So people like me will work more upon the segment which is NLP, natural language processing, and also to a great extent ML part. If you ask me, Dr. Hara, is there any programming, and if I can, what should I learn? So I would strongly encourage learning Python and R. Okay. At last, I would like to ask, please give me some suggestions that you want to the youth that comes into this industry. They are really willing to come in this industry, but they are lacking due to this technology. Yeah. Because there are some aspects that the youth is not available or not handy on the hand on this technology. How we can that? Yeah. So recently, as you know, that in 2023 we had the global summit of AI, right? Yeah. Our team headed it, and the new Delhi regulations
past related to artificial intelligence. So if you ask me, this is going to be a very booming sector, especially post-COVID. The rise has been huge. Last year, I remember towards the end of November, there was launch of ChatGPT, and now towards the end of November, we had the launch of Gemini. Nobody knows what the next will be. So it's a very booming sector. That's the first thing. So I will request and ask all the people who are out in the market, in the colleges or like graduating, to start upskilling and thinking around it, because it will give you a lot of good opportunities in the long term. But yes, as everything is new, so you have to be a little bit patient. You have to understand that a lot of pivoting will be needed, and your career graph is a little bit unstructured. But yes, a lot of exponential growth opportunities there.
Okay, thank you so much, sir, for